to 10 p.m. Turning conventional wisdom on its head. Songezo Mapete on SAFM.
It's Health on Monday. 750AMPED is a proactive intervention that leverages the power of youth to inspire changes in social behavior through training, education, and awareness, while simultaneously alleviating panic, combating stigma, misinformation, and disinformation around COVID-19 among socially vulnerable communities and areas with high transmission potential. This program will run for 6 months from May, counting until October. There is a website and an app that has been unveiled, and this will bring technology as part of the solution, crafting for the journey to zero infections. This national campaign specifically targets the socially vulnerable South African communities through providing education and awareness around COVID-19. Even more, the campaign will provide an integrated research approach to add value and effectiveness of the proposed intervention. Well, we have the CEO of Pax Africana Holdings, Murendeni Nefale, Mr. Murendeni Nefale, to talk to us more about this. Murendeni, thank you so much for your time. Good evening. Welcome to SFA Viewpoint. We haven't spoken before. Are you well?
Good evening, Songezo. Thank you so much for having me on the show. I'm doing well this evening.
We appreciate your time. Tell us more about this initiative running for 6 months to really bring on board those, a lot of the time, the system, whatever the system might be defined as, tends to, if not overlook, forget, or somehow not reach for want of resources. You're stepping in right there.
Yes, sir. I think, one of the things that excites myself and the team is who we are sort of equipping and empowering to roll out this campaign. The foundation of the 750AMPED campaign is all about utilizing the power of youth during times of crisis. That's how we phrased it. And so we have identified in the various provinces those that have been the most affected by the virus and the most infected. We then have identified specific locations where young people have been recruited from those communities, and we are training, equipping, empowering those young people to then go back into their said communities and educate people. We empower them about the virus. We talk to them about what the virus is, how it functions, how it's transmitted, the symptoms, and some of the major protective measures that one can take. And they then go out into the community and educate the community about the virus.
I didn't miss the shade you threw at me. I had said 750AMPED. You just made sure to say 750AMP. Thanks for that, Murendeni.
It's no shade. It's no shade,
No, I appreciate that. Let's talk about, some of the critical discussions which, in my view, are not happening enough and should be happening more and more. And I think for the most part, it's clear and obvious that the COVID-19, if anything, has brought to the fore the stark realities of many South Africans, especially the socio-economic vulnerability of South Africa as a people, really, that it is through this COVID that you really get to see the successes of government over the last 25, 26 years, especially its failures, because now a lot of these things which are now in high demand really ought to have been taken care of quite some time ago in this democratic project it takes for COVID-19 to really give us a grim picture as we are seeing.
No, that's so true. We look at our healthcare system and we look at how the Department of Health and the government have had years to sort of prepare. But I think sometimes it's difficult to prepare for something of this nature. I think as we look at the global reality, many healthcare systems have been put under pressure. I think ours have been put under more pressure because, as you said, the vulnerabilities have been highlighted. As we look at a time like this, a crisis like this that is affecting the whole world, and you see officials across the globe trying to respond, I think you see analysts and different members of the leadership of the country sort of seeing the wins and the losses. So there's some things that have been highlighted that have not been great, but then there are actually some things that I think we have pleasantly been surprised by how well sort of our infrastructure actually has handled this pandemic, because we are commended by a number of countries, by the WHO themselves, that South Africa has actually handled this rather well compared to other countries. And so I think with most things, there are good things that you can see, and then there are things that aren't so good that you can pick up. And I think it's the same that can be said about our context.
And stigma is one of those things that are not so good, because it's not a behavioral issue that is at stake here. It's not as if somebody has been irresponsible. Why is COVID attracting stigma? We know what stigma can do, because if you think back some 25, 30 years ago with HIV and AIDS, and how it was a stigma that was one of the lead causes for ultimately the deaths that were occasioned as a result of HIV and AIDS. We certainly don't want to follow that route with COVID-19.
Definitely not, Songezo. And as you talk about stigma, one of the things that we've had the privilege of sort of experiencing as we've started to roll out this campaign is the reality of the challenges and the dynamics on the ground. So last week, my team and I, so we've been preparing for this campaign for the past 2 months.
Yes.
And last week, my team and I then split out across the 5 provinces that have been the most affected by this virus, namely the Western Cape, Gauteng, the Eastern Cape, KwaZulu-Natal, and the Free State. And as we got on the ground, we were then training the young people. So we had face-to-face interactions, of course, practicing social distancing, providing PPE for them, training them and equipping them, sort of answering some of the questions that they had. But it's when we started sending them out that we saw the reality of the myths that exist about this virus, and some of the stigma that exists when people find out, or when people articulate with their neighbors and with their family members that they are positive. It had me thinking about sort of the early days when HIV and AIDS was starting to become a massive pandemic in the country, and the stigma associated with somebody talking about their status. We're using the language even now with COVID-19 about one's status being revealed. And it's I think there's a human psyche part of it that's almost unavoidable. Where stigma is a part of society. Unfortunately, when we don't understand something, we tend to speculate. We tend to fill in the gaps. And I think that's where some of that stigma then is sort of coming from and is birthed from.
750 amped. 7, fighting the coronavirus 7 days a week. 5 basic protective measures to fight the coronavirus. 0, the journey towards zero infections. The CEO of Pax Africana Holdings, Mr. Murendeni Nefale, is on the line talking to us about this wonderful initiative in using the power of young people to respond to the COVID-19 crisis in our communities. If you wish to contribute or ask any question or get some clarity on a particular issue he has so far raised or hoping that he will raise, please do engage us. 0891 104 207. Those are the lines. Call them now, please. WhatsApp voice notes otherwise. 0614 104 107. Murendeni, talk to us about the program now and how it will be rolled out, when it will be rolled out.
Yes, thank you for that question and that opportunity. So we are rolling it out in a couple of phases. So I've already articulated that we are focusing on some of the provinces that have been the most affected by this virus. So it's a national campaign. We've also got a sort of a social media presence, a media presence in the other provinces, but we're focusing on the 5 provinces that have been affected the most. The first phase is we're looking at so last week, as I mentioned, we were on the ground in the townships that have been the most affected, and in Western Cape we're at Khayelitsha, in Gauteng, Alexandra, in KZN, Umlazi, in Bloemfontein. I mean, in the Free State we're in Bloemfontein, and then in the Eastern Cape we're in East London. And so for the remainder of this month, we're focusing on mobilizing the young people and getting them ready to go out in those specific sites. But in total, we have 45 locations that we're actually then going to be executing. So we wanted to get some learnings from sort of this first phase of rolling out. We were regrouping this week. We're identifying what worked well, what didn't work as well, and we're trying to improve this machine as we're going along. And so this first phase involves these 5 locations, 1 location in each of the 5 provinces. And then as we start into June, then we slowly start to roll out multiple more locations. As we've already articulated and mentioned, we're identifying the most dense areas in the country. So the areas where it's difficult to practice social distancing, the area where there's a difficulty in access to some of the main resources that are required for people to actually sort of practice the preventative measures. And we're going out there to help the community sort of better understand what it looks like to do so despite those challenges in their communities. And so that, as I mentioned, that first phase then involves those initial sites, and then we roll out, and over the period of 6 months, we plan to be in multiple locations across the 5 provinces. The first phase will involve primarily being on the ground. And then the second part of it also involves utilizing a website and an application. And so on the website, we'll have additional information on the virus. On the website, we will also be utilizing some analytics where people can sort of see the spread of the virus. So sort of sourcing information from the NICD, from the Department of Health, as we're building partnerships with those organizations to have as much information for the people, as much information for our communities, to be able to understand and to really combat this. As the President mentioned, we're fighting an invisible enemy. And in so doing, we're trying to utilize as many tools and resources to combat this as effectively. So that's sort of the approach that we're going to be taking. It's those phases, and then it's utilizing a number of different tools and resources, website and app, and then additionally social media.
Excellent. Just to recap, Gauteng, Pan Africa Mall, Alexandra, Free State, Hoffman Square, Bloemfontein CBD, KwaZulu Natal, Umlazi Mega City Shopping Mall, Eastern Cape, Gilwell Taxi Retail Park, Western Cape, Khayelitsha Hospital. That's where the launch will be through these 5 provinces. Of course, there are 45 locations in total nationwide, using young people to inspire changes in social behavior through training, education and awareness, while simultaneously alleviating panic, combating stigma, misinformation and disinformation around COVID-19. You mentioned that you will target people on the ground primarily, and then you will engage them on the website and applications and social media and the like. Dare I say that your work at level 1, on the ground, engaging the people through young people, is where really the majority of your work and time and resources possibly will be consumed. We know that a lot of South Africans are not as on board in relation to online spread and engagement of information. Certainly when you talk about websites, you ostracize the majority of South African, as you do when you talk about applications, because of the assumptions that might carry with smartphones and availability of data, oftentimes scarce commodities.
Yes, and in fact, you've identified quite a number of key points there, Sonia. And I think that's why we intentionally took this approach. We wanted to cover this from as many angles as possible. And so the on the ground, you'd probably imagine that that's where we're getting a lot of face-to-face interaction with the majority of the population. I mean, as we speak about, one of the big challenges with this virus is the people are not practicing social distancing. So people are not staying the distance. And as we've come to understand, the way this is spread and it's transmitted is it's when people are close. It's when you cough and you sneeze and somebody's close enough to you to pass that on to them. And so the work that we're doing on the ground definitely is very critical. And so that's why we've wanted to take a good amount of time to understand the dynamics involved in being on the ground. We're wanting to make sure that we're sending out the young people as well equipped as they possibly can be. We're ensuring that we're partnering with the right key stakeholders, with the CPF, with local hospitals and local clinics, to ensure that we're sort of bolstering the support that we can give them. Because as you can imagine, it's not an easy task to go in front of people and to talk to people about this thing that has many people fearful, you know. And so this targeted approach of being on the ground is definitely one of the areas that we spent a lot of time sort of working on. But then simultaneously, in that same breath, the digital presence. So given the reality that people are supposed to be staying home, given the reality that you still do have a number of people within the context of South Africa who do have access to the digital platforms, we wanted to make sure that we didn't miss any avenues. And so the approach that we took then is to ensure that we cover as many as we possibly can.
Certainly in the short term, this is very human capital intensive. Young people will have the energy to go on for days, so that's a good start. But having said that, people do like representation, and when I talk about representation, I'm talking really about ambassadors. Are you engaging so-called influencers or celebrities for the purposes of making the initial hit of this message and this campaign, for having the long-lasting impact of the 6-month period initially that you're looking to have?
Sure, Songezo, you ask such good questions, brother. Yeah, so
I would hope
we
so.
have the privilege.
Thank you.
We have the privilege of partnering with some dynamic organizations that some dynamic companies that have been operating in the marketing and the PR space, and they have done some amazing work, even in preparing us to ensure that we're engaging with the right people, as many of the right people as possible. And so we currently do have a strategy where we are engaging with some of the influential members in our society. I won't reveal too much of that strategy, because it's currently being rolled out and it's currently underway. But that definitely is an approach that we've taken, because as mentioned, we're trying to tackle this from as many angles as we possibly can. And so as we continue to sort of build the momentum on this campaign, as we continue to get word out there that this is what we're doing, in the same way, then we're getting that buy-in from a number of influential individuals in our communities and a number of influencers who then they have more authority than most. And so when this message, this powerful message, can come from such individuals, then it has that much more of an impact.
Let's talk institutional powers, institutional partners, because when you talk about impact, you do need institutions. For instance, the Health and Welfare Sector Education Training Authority. Just last week, we actually had the retail SETA, the retail and wholesale SETA, and there were some strong indications that part of its work is to keep the youth involved through the payment of their internship stipends in the continuous work of the retail and wholesale space. Here, I would imagine that you engage, or will engage soon, if not already, the health and welfare sector for the purposes of using these young people for these training. The Department of Health, I'm sure, is another institutional partner, as you would have at local government level, for the purposes of really infiltrating the communities. Anyone else?
Yes. I definitely must highlight the fact that we have actually been primarily partnering with the Health and Welfare SETA. This is an initiative that's being rolled out in partnership with them, and so we've had a lot of buy-in and support from them, and we've had some conversations with different members of the Department of Health across a number of the provinces. And we've also been engaging with a number of the local municipalities and the leaders that we're leveraging our networks as much as possible. If ever there was a time to sort of trade in all the hard work and the leveraging and the networking that we've been working on, I think such a time as this. This is when we're supposed to then ensure that we're tapping into as many of our networks as we possibly can. And so a number of those institutions and a couple more, we are currently sort of knocking on their doors, continuing to share the vision. I think a big part of this then is sharing the vision. We talk about trying to inspire hope. We talk about trying to inspire hope in changing social behavior. We talk about the utilization of the power of youth during times of crisis. We talk about awareness. We talk about sort of dispelling myths and stigma and alleviating panic. All these languages and all these catchphrases, we're in that phase where we can safely say and confidently say that we're building momentum, and all these various partnerships and key stakeholders, we're getting more buy-in with every passing day. So this kind of interview is great. So we appreciate any opportunity that we can get to actually talk about this campaign and this initiative that we're sort of rolling out.
We sure do have an obligation, and we're glad that you could honor the time, and we're also equally impressed by the campaign itself and what it promises. We can only wish you all the best. To Murendeni Nefale, CEO of Pax Africana Holdings.
Thank you so much, Songezo. If I can quickly then just share for those who have who would want more additional information.
Yes.
We're currently present on Twitter and Instagram. Our handles are at 750amped. On Facebook, 750-amped. You can email inquiries at 750amped.co.za, and you can actually get more information on www.750amped.co.za. And our developers are consistently working on our app and on the website. As the week goes by, there'll be more content that is readily available. Thank you so much for this opportunity, Sonia.
You go well, Murendeni. Much appreciated. For those of you who want to make further content on any of the platforms that he has highlighted, 750 Amped is spelt 750, the numerals, and Amped is AMPED. It's now time for the book reading. It's 21:31.